This is NNI Bites, Big Learnings, a podcast where fellow healthcare professionals converse about the latest in nutrition science. We are joined by the chairs and speakers of NNI and WNSC Workshop 103 as they share practical insights on early life nutrition and its impact on children's long-term well-being.
Hello and welcome to NNI Bites Big Learnings, the Nestlé Nutrition Institute podcast, where we explore emerging science shaping nutrition and health across the lifespan. I'm Yvan Vandenplas, based in Brussels, Belgium, and I'm your host for today. And I'm thrilled to welcome Dr. Rosan Meyer, pediatric research dietitian and visiting professor in the Catholic University of Leuven, also in Belgium. Dr. Meyer is an internationally recognized expert in pediatric allergy and nutrition, with a particular focus on how early life feeding practices influence immune development and food allergy risk.
Thank you so much for the kind introduction, Yvan. It's a pleasure to be here and to discuss this important intersection between complementary feeding and allergy prevention.
So, I have some questions for you. The first question I have is, your work focuses on the role of complementary feeding in food allergy prevention. How does the age of introduction matter?
That's a very important question, Yvan, and has seemed to evolve over the years. What the research has shown is that there seems to be a window of opportunity, which is around 4 to 6 months of age in terms of allergy prevention. And the evidence in particular led by the LEAP and then the EAT study had shown that the earlier that we introduce the peanut in particular, and then came also egg, to the 6-month mark, the higher the impact in terms of the preventative effect. So there is a very important window of opportunity. Conversely, I also want to say that introducing it too early, that is before 4 months of age, has the opposite effect, so has not shown a benefit. So it seems really that we've got this window where we want to be introducing just at the right time and not beyond that for allergy prevention.
Okay, and do we know if prematurity plays a role there?
That's a very important question, actually, because the studies that we have to date have not included preterm infants. And in particular, what I mean by that is, from 36 weeks or below. What we have done, and I can just talk about the pragmatic view, is to think about a preterm infant in a very similar way and say that if a child was born preterm from a chronological age, you would also, if there's high risk, implement the same guidance that we have for full-term infants in terms of prevention.
Okay, thank you. There has been much discussion about when to introduce solid foods. How do current guidelines reconcile complementary feeding timing with breastfeeding recommendations?
That's it's actually for many people an easy question to answer, but actually it can also be seen as controversial and difficult. I always start with the research, and the research from the EAT study. So I want to just, for those of people who don't know the EAT study, the study recruited children that were all breastfed, and either breastfed according to the 6 months mark and then complementary foods introduced, or they were breastfed and alongside breastfeeding, allergens were introduced early. And that study indicated that those children where the allergens were introduced earlier, breastfeeding was not displaced. So what we always say is that in regards to supporting breastfeeding, the early introduction of allergens for allergy prevention does not distract from the fact that we still promote breastfeeding exclusively. And so whilst we say we have a window of opportunity, we would still say that is alongside breastfeeding. I think the question that we need to ask ourselves is developed versus developing countries. And I think that needs to be seen from a public health perspective. And there was a wonderful recent publication on that to debate and saying some countries where allergies may not be as prevalent, your benefit may be more waiting until 6 months and continuing with exclusive breastfeeding. So it really depends on the country, but certainly the message remains the same, that that breastfeeding needs to continue alongside complementary feeding, also for allergy prevention.
So is there evidence supporting early allergen introduction? Is there a difference between non-at-risk or high-risk infants for allergy?
So yes, that's also a really excellent question. So the answer would be yes. We have many studies here that have looked at that. The primary impact we've seen is in particular with peanut early introduction. That's through the LEAP study, and the LEAP studies even now looked at their LEAP-ON study. So that means introduction early at 2 grams of peanut protein maintained below 1 year of age, and as I said before earlier, closer to 6 months of age, has a long-term impact and significant reduction in terms of peanut allergy. And from the EAT study, and you've had other studies as well, have shown an early impact of egg introduction as well. Egg in particular, not raw egg, but cooked egg. In regards to the other specific food allergens, the evidence is not wowing us yet. I think there is an argument which we can't fully answer yet, is around the early introduction of cow's milk. And I think that is a question that is still outstanding with good randomized controlled studies to come. There is a protocol that has just been published from our Polish colleagues that are going to look at that question specifically. So the answer would be peanut and egg. And you said, what about high risk? And I want to be clear here that LEAP defines high risk very specifically. Those children with eczema and or egg allergy is defined as high risk. You will find in guidelines other groups that are seen as high risk, i.e. the family, parents, father, mother, being atopic. But if we go by what LEAP and EAT specifically suggested, that is suggested as high risk.
Okay, thank you. Beyond timing, what practical advice can healthcare professionals offer to parents when introducing complementary foods for allergy prevention? So does it matter which kind of complementary foods first?
Yeah. So it's a topic of debate. What I can already say is that there's a lovely new publication on complementary feeding around the immune modulatory role and allergy prevention. And it goes as follows. The first aspect beyond the timing is that you want to diversify the diet rather quickly. Diversify the diet does not mean I want to just have in the same category, so just 5 different types of fruits. You want to diversify along vegetables, grains, fruit, and also we now know that nuts and seeds is really great for the microbiome. Along the diversification, then, of course, we introduce the allergens. So we've spoken about peanut and egg, but I also want to highlight, so whilst peanut and egg, we have the early active introduction, we do not delay the other allergens. That means we don't delay the other nuts, we don't delay wheat, fish, and all of those things. I think what is also important, because we know that different people will listen to this podcast, is to acknowledge that within every country, there will be culturally specific foods. So we don't advocate for a specific food that, for example, is UK-based or Belgian-based. We advocate for locally sustainable, big variety, and food that is affordable, that can be along the allergens introduced in a orderly manner.
Okay, so dietary diversity is often emphasized. How does that relate to allergy outcomes and long-term health?
So I want to first come clean. Dietary diversity is not my primary speciality, but Professor Karina Fenter has really devoted the last, I think, 5 or 10 years towards that. In a sum total, in a nutshell, before I go into the smaller details, is that dietary diversity overall has had a positive impact when you look at atopic outcomes per se. So asthma, eczema, hay fever, and dietary diversity has more recently also shown outcome in terms of food allergy per se. And we're not talking only about the peanut and egg, but food allergy per se. What is important to acknowledge is that dietary diversity during complementary feeding is important, and I'll come to that in a second, but I want to also just say, whilst we talk about complementary feeding, diversity of diet during pregnancy is also important. When we're thinking about dietary diversity during complementary feeding, as I already said, it's not around diversity around the same categories, around diversity around a variety of different food groups that seem to be really important. In specific, the recent data has shown diversity around plant-based foods being allergy preventative. And I know that Liam O'Mahony's data has highlighted nuts in particular have shown, and in particular now recently, peanut, for example, showed Blautia as a specific probiotic that has an allergy preventative effect that has been increased through peanuts and nuts. So I think that's often forgotten, that it's the diversity around plant-based foods in particular that has an allergy preventative effect.
Okay, going back to introduction of complementary feeding, we have infants with or without cow's milk allergy.
Yep.
Should the introduction of complementary feeding be different in those groups or the same?
Yeah, no, that's also, so you talk about primary prevention, which we've been talking up to this point, but secondary prevention means you have a child that already has got an allergy. That might be cow's milk, which is one of the most common allergens. Even in those children, if a child is not allergic, you actively introduce. And I want to also bring something else with them. Even in a child with cow's milk allergy, we would also go and talk to our gastroenterologist and our allergist, and where possibly we would bring in the allergens that they're allergic to early through a ladder or through baked milk introduction. So even with the allergens that they are allergic to, we'll think about more active introduction. So that's a huge change. But the message should be, do not delay allergens unless a child is allergic to them.
So, Dr. Meyer, thank you for sharing such insightful and evidence-based perspectives. Before we close, what's the one message you'd like to leave to our listeners?
It's always difficult when somebody asks me about the one message. I would now say, if any healthcare professional is listening to this, to say don't over-medicalize complementary feeding, in particular around food allergy prevention. Food is still around enjoyment, what is culturally acceptable, and also what leads to a good nutritional status, not just about allergy prevention. So I think it's this holistic approach around thinking around your environment and pediatric nutrition overall.
Thank you. Thank you again, Dr. Meyer, for joining us on NNI Bites Big Learnings. And thank you to our listeners for tuning in. Stay with us for more episodes exploring how science, nutrition, and innovation come together to build healthier futures, starting from the first bites of life.
And that concludes today's episode. Thank you for joining us for this special episode from NNI and WNSC Workshop 103. We hope you enjoyed and learned from this quick discussion, fellow experts. Till the next episode.